Greetings. My name is Dr. Erica Daniels, and I am an assistant professor of counseling at Evangel University within the online graduate counseling program. I am a licensed professional school counselor and a nationally certified counselor. In this video, we will discuss the Association for Counselor Education and Supervision Best Practices in Supervision. Let's begin. The Association for Counselor Education and Supervision established a task force in order to formulate a relevant and useful set of best practice guidelines for clinical supervisors, regardless of the work setting. The ACES Best Practices in Clinical Supervision document was drafted in 2011 and still provides relevant best practices for use today. The full document can be found on the ACES website or with a simple Google search for ACES Best Practices in Clinical Supervision. The document highlights 12 best practices with detailed criteria of what these best practices look like in practice. I will summarize each of them for you. The first best practice is related to initiating supervision. This states that the supervisor engages in sound, informed consent practices in the initial supervision session. Additionally, the supervisor explicitly states clear parameters for conducting supervision. Within the informed consent, the supervisor verbally describes and provides the supervisee with written contact that outlines the expectations of the supervisor and supervisee. This contract can be negotiated to meet the needs of the particular supervisee. In academic settings, the supervisor employs written contracts specifying and differentiating the responsibilities of the university and the site supervisor. This is a conversation to be had with the supervisee, the supervisor, and the faculty supervisor. The supervisor also provides the supervisee with a professional disclosure statement, providing his or her academic background in both counseling and supervision. The supervisor will also emphasize documents including the contract, syllabus, professional disclosure statement, and that they will be discussed throughout supervision as needed. And the supervisor clearly delineates his or her responsibility and authority to ensure client safety and effective treatment. As it relates to setting clear parameters for conducting supervision, the supervisor and supervisee agree on time, place, and duration of supervision. However, within site supervision, it's important to note that some of these parameters are established by the university and as well as KCRAP standards. The supervisor delineates the responsibilities regarding the preparation for and conducting supervision, and the supervisor includes or addresses necessary forms related to supervision that the supervisor, supervisee, and others need to be mindful of. The supervisor also facilitates a discussion within initiating the supervisory relationship, initiates a discussion, or facilitates a discussion about the supervision process to foster a supervisory working relationship. This means that the supervisor establishes a supervisory working alliance that's collaborative and egalitarian, that the supervisor describes his or her role as supervisor, that the supervisor describes the structure, process, and content and forms of supervision sessions, and the supervisor and supervisee discuss the supervisee's past experiences in supervision. This may not necessarily apply to students in field experiences. Number 2 is goal setting. To the extent possible, the supervisor co-develops specific goals for supervision with the supervisee. The supervisor also emphasizes goals that directly benefit the therapeutic alliance between the supervisee and the client and the effectiveness of the services provided. The supervisor is also intentional about addressing and evaluating goals in each supervision session. Number 3, giving feedback. The supervisor provides regular and ongoing feedback and is expected to provide a manageable amount of feedback in each session, balance of challenging and supportive feedback, and provides feedback as close to the counseling session being reviewed as possible. The supervisor helps the supervisee process that feedback, and the supervisor's feedback is based on direct observation of the client in the counseling session. The supervisor also provides direct feedback as necessary that focuses on the supervisee's behaviors that might need to be changed, constructive feedback that's specific, concrete, and descriptive, and the supervisor pays attention to the multiple sources of feedback that's available to the supervisee. So in essence, the supervisor helps the supervisee gather information on performance feedback from multiple sources, from clients, peers, other supervisors, using informal methods and other formal methods. So with formative evaluations as well as summative evaluations. Number 4, conducting supervision. The supervisor then adheres to appropriate professional standards, accreditation, certification, and licensure regulations in establishing the frequency and modality of the supervision sessions. The supervisor is also responsible for providing a safe and supportive and structured supervision climate and uses a variety of supervisory interventions, direct observation, counting, addressing a range of supervision foci that include counseling performance skills, cognitive counseling skills, case conceptualization, self-awareness, and professional behaviors. The supervisor chooses a group supervision format for multiple reasons. Time efficiency is not a primary rationale. When working with field placement, it is important to note that students will also receive group supervision within the university in which they attend. Also, in conducting supervision, the supervisor may choose triadic supervision format for multiple reasons as well as employ technology in ways that may enhance the supervisory process and the development of the supervisee. In academic and post-degree supervision, the supervisor actively evaluates the course of supervision on an ongoing basis. In academic settings, the university supervisor ensures that there's a mutual agreement among the university supervisor, site supervisor, and supervisee about the expectations. For field placement, field-based practicum and internship students, the supervisor provides a procedure by which the supervisee can provide feedback about the site that does not result in a negative consequence for the supervisee. Number 5, the supervisory relationship. The supervisor operates with an awareness that the supervisory relationship is key to the effectiveness of supervision, as well as the growth and development of the supervisee. The supervisor intentionally engages with the supervisee to facilitate development of a productive supervisory relationship and working alliance. The supervisor also attends to ethical and cultural concerns that impact the supervisory relationship. Number 6, diversity and advocacy considerations. The supervisor recognizes that all supervision is multicultural supervision and infuses multicultural considerations into his or her approach of supervision. The supervisor also encourages the supervisee to infuse diversity and advocacy considerations in their work with clients. Ethical considerations. The supervisor is to convey to the supervisee that both the supervisor and supervisee are expected to adhere to the ethical codes and guidelines endorsed by the American Counseling Association and other divisions of ACA, relevant credentialing bodies, and models of ethical behavior, to include the American School Counseling Association. The supervisor continually monitors his or her own level of competence in providing supervision and acts accordingly, understands that client welfare is his or her highest and first responsibility and acts accordingly, and does not compromise the supervisory relationship by engaging in relationships with supervisees that are inappropriate. The supervisor provides ongoing performance assessment and evaluation of the supervisee, including supervisee strengths and limitations. 8, documentation. The supervisor maintains documentation that provides a system of supervisor accountability. 9, evaluation. The supervisor understands that evaluation is a fundamental part of supervision and accepts their responsibilities related to evaluation. They clearly communicate the evaluation plan to the supervisee, and the supervisor encourages ongoing supervisee self-evaluation, as well as the supervisor takes appropriate steps to remediate when necessary. Within the evaluative process for field experience for in academic settings, it is important to note that evaluation is a critical component, and conversations with the faculty or university supervisor may necessitate when there is remediation that needs to take place with the field experience student. Number 10, supervision format. The supervisor employs various supervision formats and ways to adhere to accreditation standards or regulations of credentialing bodies, and that meets the needs of the supervisee, is appropriate to the site, and adequately addresses the needs of the clients. The supervisor does not choose a format based on what may be convenient for the supervisor. The supervisor, number 11, is to be competent in providing clinical supervision. Competent and experienced practitioner who has knowledge of a range of theoretical orientations and techniques and experience with diverse populations relevant to their counseling setting. The supervisor should be highly competent, morally sensitive, and ethical in the practices of counseling and supervision, has formal training in clinical supervision, and possesses a strong professional identity as a counselor and supervisor. The supervisor can clearly describe the purpose of clinical supervision and distinguish it from the counseling process, as well as other forms of administrative and program supervision. And the supervisor has a collaborative relationship with additional supervisors with whom the supervisee may be working with. The supervisor also engages in self-reflection and other avenues of professional development and serves to manage supervisory relationship dynamics competently and appropriately. Lastly, number 12, supervisor preparation, training, and supervision of supervision. The supervisor here has received didactic instruction and experiential training in clinical supervision, that their training is based on a developmental perspective and approach, and that instruction includes topics and guidelines relevant to professional organizations and credentialing bodies. The training emphasizes theoretical and conceptual knowledge and skills, appropriate application of teaching, counseling, and consulting skills, role modeling. Supervisory relationship is the primary vehicle for supervision. Training includes an emphasis on managing the delicate balance of and challenge in supporting the supervisee. Includes instruction relevant to learning theories, principles, and research. Is trained to understand that their focus includes both clinical and professional development of the supervisee. The recognition of the needs for different approaches, format, structures, and types of supervision that may be different for supervision settings. The supervisor is able to articulate a personal philosophy of supervision as a result of that training, and that the training includes supervision of supervision based in some form of direct observation of his or her work with supervisees. This concludes the summary of ACES best practices, and again, you're able to find this document in full on the ACES website or with a simple Google search for ACES best practices in clinical supervision.